Fanning her newborn baby, Rubina Malla is stranded in a school building that is being used as a shelter for the displaced in the flood-ravaged Sindh province of Pakistan. Rubina is one among hundreds of pregnant women who had no choice but to take a perilous 3-hour boat journey across floodwaters to get to the nearest hospital. Rubina and her family had initially decided to shelter at home as they had nowhere to relocate. They also didn't have access to the government's relief missions. However, it was Rubina and her husband's indomitable spirit which persisted for her baby in spite of the grave dangers the catastrophic floods posed.
हमारे जोरों और पानी फैल गया हम लोग बहुत परेशान हो गए तो हम कहाँ जाएंगे कैसे जाएंगे मेरा हस्बैंड चल गया कश्ती लेके आया कश्ती में हम दोनों गए हॉस्पिटल में हम गरीब थे तो 7 हॉस्पिटल में गए थे वहाँ पर मेरी डिलीवरी हुई ही.
There are tens of thousands of pregnant women in Pakistan who have been forced to tread through floodwater just to give birth. A report from the Sindh Government has only raised fears of giving birth in such harrowing conditions. According to the data, only about 900 and more than 100,000 pregnant women displaced by the massive floods across Pakistan's Sindh province have made it to relief camps. And the situation continues to deteriorate. Pakistan is deep in the throes of a humanitarian emergency. The floods in the country, triggered by erratic monsoon rains, have broken existing records. Exposing a set of problems that paralyze Pakistan, the floodwaters are wiping away everything in their path, including the futures of many. For those who have been forced to leave their homes, the situation is dire. The floods have also caused a multitude of other crises throughout Pakistan. As Pakistan continues to grapple with debilitating floods, people living in several relief camps are contracting waterborne diseases. Hospitals are overwhelmed with patients. The already fragile health system of the country is becoming increasingly strained. According to staff at the Civil Hospital of Dadu City, they have received over 72,000 patients in recent days, mostly suffering from diarrhea and gastric illnesses. There has also been an uptick in malaria cases.
हालिया बारिशों की वजह से हमारे यहाँ दादू डिस्ट्रिक्ट में गैस्ट्रो में डायरिया में और मलेरिया में काफ़ी केसेस ज़्यादा हुए हैं. तकरीबन 150 से ज़्यादा डायरिया के केसेस डेली हम इधर एडमिट करते हैं और तकरीबन 5 से 10 ये मलेरिया के केसेस भी हम रोज़ाना दाखिल करते हैं. जो ये पानी जमा होने की वजह से मलेरिया हुआ है और पानी जमा होने की वजह से ये सफाई ना हुई उसमें डायरिया में काफ़ी हद तक इजाफा हुआ है.
In July and August this year, Pakistan received 391 millimeters of rain, nearly 190% more than the 30-year average. The most affected, Pakistan's Sindh province, has witnessed 466% more rain than average, which has taken a massive toll on women and other underprivileged groups in the country. The government says the lives of nearly 33 million have been disrupted. Islamabad estimates the damage at $30 billion USD. The international community has appealed for assistance. United Nations Chief Antonio Guterres visited several areas of Pakistan ravaged by floods and urged countries to provide humanitarian relief to Pakistan. Some help has already flowed in, including a tranche from the International Monetary Fund. Other countries are also considering providing assistance. However, because corruption continues to be a problem throughout Pakistan, the question remains whether the relief and money provided by the international community will be used to help the country's most vulnerable, the very people the aid is intended to help.